I remember there was a time when people argued that we shouldn't have to write this down at all. That was right during the same time that the people complained because they couldn't wear blue jeans to work. But I don't know if you were around during that time, Phil, but there literally was an argument that said, people were arguing, say, I shouldn't have to document anything. And so then when they did document, it was sketchy at best. And then you had people, organizations, I remember like several partial hospitalization organizations that were just committing fraud. They were submitting documentation and bills and stuff. And I think part of on the other side of it, I think the payers got tired of getting these vague notes that were, and when you ask, is the person better? And the clinicians say, well, I don't know, maybe, I mean, and so I think there was a reasonable reason for kind of asking for better documentation, but it's gone overboard.